All right, very good. And I want to welcome everybody to our October 6, 2021 meeting of the Health and Wellness Advisory Committee. And just say thank you very much for joining us. I just said before we started, we got such a great group, and I appreciate you, sharing your expertise and your time with the city of Charleston and helping make our area better. I think we have we're in the fourth quarter of 2021 now, being in October. I think we have about 11 or so weeks till Christmas, 12 weeks left in 2021. So we're down the home stretch here in the fourth quarter. And I appreciate all the work that everybody has done up to this point, and look forward to the good things that are coming here for year end. Paul has put up the agenda for us. I think everybody can see that. And I would move for approval of the minutes. Paul sent them out on Monday. So if I can have a second for the approval of minutes from September 1st, please.
Second.
Well, thank you very much. And we will jump right into our community health update, and I will call on Dr. Katie Richardson. And thank you for being here, and we will let her take it from here.
Thanks for having me. So I wanted to cover a few things this morning. The first is flu. In some ways, it's nice for COVID not to be at the top of the list, but unfortunately, COVID is still here. Flu is on the way. So flu vaccines are going to be very important this year. We did not see many cases of flu last year, and that means less natural immunity in our communities against the flu. In addition, our hospitals are still seeing significant hospitalizations around COVID. Flu in a normal year also causes a significant number of hospitalizations, and that added strain may be very difficult for our hospitals to handle this year. So vaccines are already available in many pharmacies and providers' offices. DHEC will begin school-located vaccine clinics for flu vaccines, and potentially down the road a little for COVID vaccines as well. We'll begin that mid-October. That will include us going into the Charleston County School District to provide those. So parent permission slips will be coming out soon, if not already. We do see flu many years as early as October and as late as May. So we are recommending the flu vaccine for those who haven't gotten it to please try to get it in October. But it's always better better to get it late if not sooner. So try to get it in October if possible, but get it whenever you can. I think that's the end of what I'm going to say about flu, other than what we know is like COVID vaccine. The flu vaccine significantly decreases the risk of severe disease. So the hospitalizations and deaths. And we may and probably will see flu and COVID, as I said at the beginning, circulating together. So on that note, if you have respiratory symptoms consistent with flu and COVID, please get tested for both so that we are able to know what is going on in the community. The last thing I want to say about that is you can receive your flu vaccine and your COVID booster or your COVID primary series for anyone who's not gotten that at the same time. So many providers will give those in different arms. That's not even required. So that's often more convenient. You certainly don't need to do it that way, but both are available now. With are recommended. Just moving on to the booster. Pfizer has now been approved as a booster for 4 groups. So 2 are in what we call the should category, so should get a booster. Those are people over 65 or over, and residents in long-term care facilities. That's one group. The second group is people aged 50 to 64 with certain underlying medical conditions. That is, if you've received at least 1 dose of the Pfizer vaccine as your primary series. There's also 2 categories of may receive the booster, weighing the risk and benefits. Those are people aged 18 to 49 who are at high risk for severe COVID, the underlying medical conditions, and those aged 18 to 64 who are at increased risk for COVID exposure and transmission because of occupational or institutional setting. And all of those are by what we call self-attestation. So it's up to you and, in consultation with your provider to decide if you do fit those categories, if you feel like you're at increased risk. And what I've been generally saying is certainly if you fall in more than one of these categories, so maybe you're 18 to 49 and pregnant, which is one of those certain underlying medical conditions, and you work in a field with increased occupational exposure, that likely moves you more from the may to the, consider strongly category. So that being said, we've gotten lots of questions about, well, what if I got Moderna and Johnson & Johnson? And we have heard that the FDA will be meeting in mid-October. So that will be, I believe, next week to consider the data that Moderna has submitted on their booster. As well as potentially Johnson & Johnson, if they have had a chance to review all of that. And there's also a possibility that they will consider the data about mixing vaccines. So, can people get a booster of a vaccine that they did not get in their primary series? So we're looking forward to that, that data, those recommendations first from the FDA, then the CDC. But at this time, a booster is not recommended for those who did not receive at least 1 dose of Pfizer from the beginning. There is that one caveat of those who are immunocompromised, and the EUA does cover a 3rd dose for anyone immunocompromised who received Pfizer or Moderna right now. So, so that's adult booster information. It's still our priority, and I want to definitely want to emphasize this point, is getting those who are unvaccinated through their first dose or first primary series of any of the 3 vaccines that are available. That's certainly the biggest bang for our buck in public health for decreasing risk of COVID in our communities. Moving on to children, we've also gotten word that the FDA will be meeting, I think it's the 26th of October, to review the data from Pfizer for those children ages 5 to 11 to receive the vaccine. Certainly everything we've seen from that data is very positive. It's effective, shows that the side effects are minimal, and so that, from what we know, we do hope that there will shortly thereafter come approval in the form of an EUA for that vaccine for that that particular group. In the meantime, we continue to and masking in schools universally. There has been some legal opinions that do allow now school districts to consider that or to put that in place. And Charleston County School District has really been a leader in that from the very beginning of this school year. For that, we are grateful, and certainly many of our kids have been able to stay in school and remain healthy because of that. Lastly, I just wanted to mention Paul included an attachment with the agenda on CDC Holiday Guidance that came out. Since Paul sent it out, that has actually been taken down from the CDC website. There was some pushback on it being potentially overly restrictive. And so the CDC did decide to pull it back, wants to wait and see what happens with COVID in our communities. Certainly nothing on there was untrue. But there was a lot of talk about needing to continue to have holidays virtually. And we hope not to be there, but we will need to do it safely. If it's done at all, there will be certainly some at-risk populations that will need to weigh the risk and benefits, but more to come on holiday guidance from the CDC and DHEC as we get closer to Thanksgiving and Christmas. That's what I've got today, and I'm happy to take any questions.
Thank you, Dr. Richardson. Any questions for Dr. Katie Richardson? Paul?
Katie, I put a couple things in your box. First thing, flu shots for schools. Is that in the works?
It is. So we will be beginning that mid-October. So I think that means the 15th. Basically, we got MOAs back from a number of schools, including Charleston County School District, and are looking to begin setting up those clinics. So DHEC nurses will go into schools to offer flu vaccines.
Will DHEC do you know where DHEC might be doing flu shots in our region area, or anything in the city of Charleston or around us?
That's a great question. I don't know if we have set up we will be offering community clinics. My understanding is that it is the same team that's working with the schools, and so we have prioritized sort of trying to get some of the schools set up first. There may be community clinics, and I will ask about that schedule and send you any schedule that's already on the books for community clinics, so that you can share that with this group.
Right. Two more questions. Is there still a deadline between the first and second shots? It used to be 42 days.
No. So if you've received your first Pfizer Moderna and not yet received your second, you may receive that at any point in time. It is still the official recommendation that if it can be done within 42 days of the first, that would be best, but it's never the case that you have to start over, have that first vaccine again. Whenever you get your second vaccine, that does complete your series for the primary series. For the booster, if it's a third dose, because of being immunocompromised, the recommendation is wait at least 28 days. And if it is a booster with Pfizer, according to the guidance that I just shared, then it is at least 6 months is the recommendation. Then we don't know what it's going to be for Moderna or Johnson & Johnson at this time.
And then the Lambda variant, do we know much about that yet?
We don't know a ton. What we know is, at least we're hopeful that it's not going to be the new Delta variant. But the more infections we have circulating in the community, the more risk there is for a variant, sort of a variant of a variant or continued mutation to happen. We certainly, I don't think most of us expected the Delta variant, right, months before. And so I think there's certainly a risk for seeing another surge, whether it's a new variant, whether it's the winter time. We certainly, we do not know that this will be our last surge. We certainly hope that will be the case, but we must remain vigilant. We must continue to try to decrease transmission in our community.
And then, Kevin, finally, I'd just like to thank Dr. Richardson and Taylor Lee for, we were getting ready for the bridge run, and they helped us review what we were doing to keep us on target and offer a few other suggestions. And so It's just nice to have medical and our health department personnel out there ready to help guide us through anything. And so we were very appreciative for your help in that event we had. And then I was reading in the paper today, and I thought you maybe just wanted to reiterate it, but people have been storming it sounds like your local offices with wanting to get exemptions or things of that nature. And it's been the paper made it sound like y'all have been taking a lot of abuse over there. And I just don't, we maybe should echo out that's not what y'all do with the exemption. So I just thought you might want to touch on that.
Yes, thank you for reminding me to bring that up. So DHEC does by law offer exemptions, medical and religious, for state mandated vaccines for children in daycare and schools. But that is the end of what DHEC is able to provide to the community. So we do not have anything to do with medical or religious exemptions for adults for the COVID vaccine or any other vaccine. If your employer is mandating the vaccine, then you must work with them. DHEC has no role to play in issuing any sort of exemption in those cases. So yes, and we have had some difficulties at several of our health departments with adults who had a different understanding, but that is always the way it has been, and that will be the way it will continue to be. The DHEC does not play a role in adult exemptions due to what your employer has put in place. Thanks for giving me the chance to say that, Paul.
Katie, can I just ask a quick question to confirm? It's my understanding that we still have a lot of work to do for those 12 and up adolescents. Do you know about what percentage of that population is vaccinated in Charleston County right now?
That is a good question. I don't have it in front of me, but that is the lowest percent. I feel like the last time I looked, it was less than 30%. Mm-hmm. If you know different, please say, but that 12 to 15 age group is the age group that has the lowest percentage of vaccinations. And, I think it's a huge carrot that schools are able to allow students who are fully vaccinated to remain in school, even if they were deemed a close contact due to being within 6 feet without a mask, or within 3 feet if both were wearing masks, if they are fully vaccinated. And so I hope it also continues to allow, sports teams to play without having those kids out, concerts to go on. As much as we want our kids to be able to have as normal a year as possible, getting that community vaccinated as soon as possible will allow that as much as anything else.
Any other questions? I have a quick question, Dr. Richardson. On the booster shots, I know you said the 18 to 49, if they had some underlying conditions, and I know you said that it was kind of up to that person, but will they have to show any proof, or can they just come up and get that booster?
That's right. They're not needing to show proof at our sites, and we are asking all providers to not require proof. And it's a fairly long list of underlying medical conditions. It is on the CDC and DHEC website. But basically anything that you might think, from hypertension to asthma to diabetes, to being a smoker, to being pregnant, to being obese. It is a long list, and all of those, I don't even think you have to attest to a single one. I think you go up and say, I do meet one of the underlying medical conditions, and that is sufficient to then receive your booster. Very
good. Okay. Well, thank you so much. If there's no other questions for Dr. Richardson, I just want to say thank you. I know that everybody with the city appreciates all the work that you do, and everybody on here, obviously, but DHEC has certainly helped us a tremendous amount in our decisions for the city. And we appreciate all that you do, Dr. Richardson. So thank you very much. So,
Kevin, if
all
I
right, well,
Kevin, could I just add one more thing for Katie? They still have their clinics open to do testing, and they're doing one over by Tanger Outlet by the Fire Museum. That's Monday through Sunday from I think 8 to 4 or 9 to 4, but it's a free clinic that would still doing testing for anybody that is thinking about they need to get just to feel better about being tested. Those are out there, and I just want to encourage people to not don't hesitate to test if you're sick, because we don't want you in the workplace or in schools getting other people sick. So.
Absolutely. And I don't want to steal Maggie's thunder, but we're also beginning testing with the school district for all students and staff on most afternoons at certain schools around, and Maggie can fill us in specifically, but it's pretty much Monday to Saturday, and gives we hope that increases access for that community. So anyone who's symptomatic, was a close contact, or just wants to be tested for whatever reason, that will be available free of charge.
all right, thank you. And Maggie, if it's okay, I will call on you during the community update if that's okay, so you can give a full report. So, or anyone else that happens to be on, that needs to give community updates, will certainly do that. So, all right. Well, thank you very much again. Next on our agenda, One Charleston Parks and Recreation Master Plan. All of you know that Jason Kronsberg is obviously our Director of Parks. Like I said earlier, probably the busiest man in Charleston, and of course Laurie Yarbrough's our Recreation Director, and they've called on these great gentlemen, Tom O'Rourke and Pat Hoagland, to come up with our Parks and Recreation Master Plan, and they've done an incredible job. They spent several months getting out, talking to all levels of constituents in the parks and recreation. They've done an incredible job of coming up with what I think is an outstanding parks and recreation master plan. So I'll first call on Jason, and then Jason can turn it over to those guys. So.
Good morning, everybody. I just wanted to kind of set this up, and as Councilmember Shealy indicated, this project was over a year in the making. We were certainly challenged through the start of COVID to get this project up and running. It took a lot of work to engage the citizens, to get that feedback. But I feel like, and Tom and Pat will verify this, that we went above and beyond to get that to get that engagement, to get that civic feedback, and with not being able to gather in large groups at the time when there was lots of unknowns, and they went out into the parks. They put on special colored T-shirts, and they met people one-on-one, and they met people that probably don't have access to the internet, perhaps would not even have looked for a public notice to see what was going on, and may have never engaged in any sort of municipal government activity. So it was really interesting to get that feedback and do these one-on-one surveys. And they went to multiple locations around the city and conducted that work. But that wasn't the only thing. There were multiple online platforms. There were statistically valid surveys that were mailed through the U.S. mail. There was online surveys. There was the Mind Mixer site. So it really was an incredible process. And going into this, we knew that we have needs. We know we have things that need to happen. And ultimately, and as a result of the plan, those needs were identified, and they're identified over a 10-year time frame. And the next step is going to be to figure out how to fund some of these things, which, as the population grows, our services should grow, in a commensurate nature, just as police and fire does, or environmental services. Parks and open space have become critical infrastructure more than ever today, especially when COVID started. People wanted to get outside. They were in our parks, they were along our trails, and it really does become critical infrastructure and the backbone of health and wellness. So with that said, I'll just turn it over to Tom and Pat. They have a little presentation they're going to give you, and it'll give you the big picture of a very large document.
Yeah. Pat, can I just set it up?
Go right ahead. Go ahead.
That's funny, Jason. We have a little present. If you saw me and Pat texting each other, it was like we weren't really sure what we were meant to do, but we will certainly condense what we have for you, because we know this is not just our meeting and you've got a lot of important work to do. I'm going to summarize a year's worth of work in about 3 sentences, and then we're going to go through it and you can see it. The city has had unbelievable deferred maintenance on parks and facilities. The city has had unprecedented growth, which means you need more facilities in areas. And the price tag for this is staggering. So I think the council made a really wise decision, and I think it was a flip of the coin. We know the public is going to have to participate in the funding of this. And I think we had first thought, let's try to bring this up for a vote this November. But everybody said, fast isn't good. We need to make sure that everybody understands exactly what their investment would be and what it would go to. So next on our work, as Jason mentioned, is to work with Jason and Laurie and the council, especially the rec committee, to discuss what recommendations we'll have for the actual funding of this plan. And so I'll stop now. We'll go through what we're going to do. There's some pretty interesting, really fun managerial recommendations that we have. So we'll go through that right now, and feel free to tell me if I'm being long-winded or whatever.
Tom's never long-winded.
Never.
So I'll try to go through this quickly as well. But there is a lot of information that we gathered over the last year and a half or so. It was a 4-phase process, the evaluate phase, where we just looked at all the programs, the facilities, benchmarking to other communities, mapping of your facilities, those kind of things. And then a lot of engagement, as Jason talked about. And then we got with our steering committee and staff and developed a new vision, mission, goals, and objectives for the future. And then from that, developed an action plan of all the recommendations for this plan. One thing we did was map the service areas. We looked at 5 different types of parks and 21 different amenities, such as ball fields and playgrounds and rec centers and aquatic facilities, and mapped a 10-minute walk and a 5-minute drive to those facilities. And what you see in red here are those areas that are the lowest and least well served in the community. And in the areas that are the best served are in the blue. The more blue it is, the higher its level of service. So it helped us identify some of those areas where we need to identify additional facilities and access. So a lot of this is about equity. We also did a thing called the Social Needs and Conditions Index, where we mapped 11 different socioeconomic factors by census tract throughout the city of Charleston to identify those areas where the people are in the most need of social services, not just parks and recreation, but any type of social services. And you see, especially a lot of the upper area of the peninsula, it's as high in that area in the red, and then over in the West Ashley area, sort of in the central West Ashley area, there's quite a bit of the red there as well. Whereas the darker blue areas are the areas that are better served or have least out of the social needs and conditions index. So this is one area to show where we can do the most good. And then we took those 2 and put them together, and the areas you see in red here are those areas where we should place priority on developing additional facilities or programs, and providing additional services. Again, so the upper area of the peninsula, West Ashley, and then some of the areas up in James Island, or some of those areas to concentrate. Not that we're only going to work in those areas, but other areas that we should focus on. So as Jason mentioned, we did a lot of meeting in the parks. You see the green shirt there. Say, let's talk Parks and Rec. We wore those out in the parks. We had 324 surveys at 19 different sites that we filled out. So it's a lot of people we talked to. We had over 2,400 webs and handout surveys, 600 mail surveys that was a statistically valid survey, and 150 participants online through it on MindMixer online engagement site. So we had, and then we also piggybacked on the Charleston City Plan public workshops that they had virtually, because a lot of the discussions there were about trails and connectivity. A lot of those discussions. So it was good to be part of that as well.
If I real quick on that, it was
Sure.
very interesting. A lot of those meetings, the planning department had to wrangle them back onto the comprehensive plan because everybody wanted to talk about Parks and Rec. So it was interesting.
Yeah, we took over a few of those. So some of those more common themes that we saw, I'm not going to read through all of them, but upgrading your existing parks and connectivity of your trails, open space, dog parks, restrooms in the parks, and restrooms that are open in the parks. Some places you've got them, but they're not even open. Making it affordable, a variety of different things. Access to the water was really important. So these are some of the key things that we heard from those all that public engagement. And then we get into some of the recommendations. Tom, why don't you talk about this?
Yeah. So as I mentioned earlier on, the growth is phenomenal. And what we have right now is a central staff that's on Meeting Street that drives there every morning, and they manage the department from there. It's okay, but as the growth goes, we feel, and we've seen in other communities, how important the link to their department is. So we recommended that there really are 5 areas of the city of Charleston that need central management: Peninsula, James Island, Johns Island, West Ashley, and Cainhoy Peninsula, which is Daniel Island and Clements Ferry Road. And so we had recommended that there is almost like their own director in each of these sites. And the relationship with the citizens will be with that person who's at that site. Certainly there will be carryover. Certainly there will be people participating outside their region. But for the most part, we wanted to make sure that there were things in that region. Pat, can you go to the next one? Yep. So what's interesting about the city of Charleston is they do some core services really, really well. And we wanted to make sure that each of these 5 regions had facilities in order to do the core services. We want aquatic features. City of Charleston does an amazing job with teaching to swim. But as all of you know, especially the ones on this call today, water is a tremendous tool for fitness and health and wellness. So we want to have aquatic facilities in each of the 5 regions. We want to have some indoor space in each of the regions for anything. We want to have outdoor space. And what we did not put on here is X number of soccer fields, X number of this, because math and geoequity of how many people live in that region will decide the number. So indoor space, outdoor court space, which could mean tennis court, pickleball court, basketball court. Trails were important to the citizens. We saw the highest number of responses to people that want to walk and ride their bikes and just be outside. I think COVID helped us, actually. It helped our profession with people just wanting to be outside. Again, we're speaking to a group of people that certainly understand the value of trails and being outside. water access. We've got water all around Charleston. We want to make sure people can get to it. Outdoor gathering spaces, event spaces, things like that. And then structures for fun and fitness, which could be anything from a playground to one of the things that ranked really high and came up with on citizen discussions that I really didn't see coming was people really like that equipment that's out on trails for fitness. And so those type of structures for outdoor fitness and outdoor fun are things too. So as I was mentioning before, the senior management staff, District 1, District 2, District 3, District 4, District 5. But if you see that block underneath it, I want to talk about that for 1 second. Currently, if somebody wants to use a facility within the city, and I'm going to just take Daniel Island, for example, there is an event there called the Daniel Island Happy Hour 5K series. And there's a series of 5 races and people come after work and it is super popular. Well, the event organizer comes into the city, Stella Fruit does a permit. I think it's $25 and they go have the event there. The person who puts on the event walks away with a couple $1,000s. The city of Charleston gets 25. And we know that the facilities in Charleston can be the host to many events, kind of many of these fitness. And what we want to do is we're recommending hiring an enterprise manager, which is a person hired with sort of an entrepreneurial mind and background that will, instead of waiting for someone to come in and say, can I get a permit? They're actually thinking, we'd like to have a triathlon. We'd like to have a walking series. We'd like to have a running series. We'd like to have special events. We'd like to host, using all of our facilities, a soccer tournament, a lacrosse tournament, things like that, where they are, from a business standpoint, actually maximizing the money that can come into the department. I did a very, very simple, quick and easy pro forma of just a few events and things to do that could bring the city in $200,000 of revenue. And I did, and I think that is so low. But what that will do is show the people that if you want to take the chance to hire this person, there will be money there to pay them and still make enough money to be able to pay for that little wing. We look at this position not necessarily at the same level as these district managers, but certainly in the room in every discussion with the director and the district managers to make sure that when facilities aren't used, they can be there for something else.
Tom,
yes.
I know we're gonna lose Maggie in at about 9:45. She has another meeting.
Yes.
Either could we take a break or maybe wrap up in the next 2 to 3 minutes? If you need
I
more than
think
that,
we could definitely wrap up in the next 2 to 3 minutes.
Okay.
Even me.
All right.
Yeah. As I said before, this is going to cost a good bit of money, but we think there is the philanthropic community that we can tie into. Pat, next. There are vacant positions in maintenance and in the workforce that have not been filled. We strongly recommended that they fill those. We strongly recommended a park ambassador program and to create maintenance standards. What the maintenance standards will do is not only be able to maintain it, it's going to give Jason the people to do it. You got a partner. Parks and Services out there, Charleston County PRC is out there, Berkeley County Schools and Berkeley County developers are interested in helping the department with land. The whole flooding situation. In this morning's paper, they're talking about the wall and the Dutch Dialogue Solutions on Johns Island. And so we just wanted to put park features into all of that. I think that's it. And we're easy to find. So if you have any individual questions, we know this was not just our meeting. Any individual questions, please reach out. We'd love to help, because health, wellness, and keeping people happy and healthy is a very big part of what this department's going to be doing and the city's going to be doing.
Thank you, Tom and Pat,
Sure.
and Jason, of course. Those guys have put a lot of hours, a lot of days into this, and they've come up with a great plan, and I really appreciate all your work. Jason, anything else before we?
Thank you all for your time. And like Tom indicated, if you have any questions, just let us know.
Great. All right. Well, thank you very much. I appreciate all your work. So I'm going to kind of skip to the community update for now, since Maggie's going to need to leave and go to a meeting early. And I'm going to call on Maggie first with Charleston County Schools.
Thank you so much. And thank you all for being so kind and accommodating. I apologize. It is exciting, the school that I'm going to visit, Bell Hall Elementary School. It was named one of the 2021 National Ribbon Schools by the U.S. Department of Education. So that's a really wonderful achievement for that school. They're one of 5 in the state of South Carolina that received that designation this year. So we are doing a little celebration for them today, which is why I have to depart early. But so for our updates, to tack on to what Dr. Richardson was saying, we are launching COVID-19 testing continuously for students and staff in a variety of locations. It actually begins today. And those locations rotate daily, at least this week. There's set locations that will kind of follow a Monday, Wednesday, Friday piece, and then other locations in different parts of the county, mainly I think Tuesday, Thursdays are in District 9 and 23, which is like Johns Island, Ravenel, Hollywood area on Tuesday, Thursdays, and then with the testing location downtown at Burke on Saturdays. Monday, Wednesday, Friday will be Lang and North Charleston and West Ashley, and Tuesday, Thursday, along with Hollywood, Ravenel would also be Lincoln High School out in District 1 in the Ondown-McClellanville area. So that's a really wonderful venture that we're going into with DHEC, hopefully providing some more access to everybody in terms of getting those rapid test and PCR tests that will both be available there. There is a consent form that has to be filled out, but that information is all available on our website. And I dropped that URL in at the top of our chat earlier today. In the past 2 weeks, our Board of Trustees, well, maybe 3 weeks now, they voted on September 20th to enforce our mask mandate that was already in place using funds that didn't fall within Proviso 1.108's prohibition of use of state funding from the 2021-22 budget. And so that enforcement began formally on September 27th. And with that came, September 20th. And with that came mask exemptions. I know we were discussing that a little bit earlier, but we had an in-house mask exemption process where there was a form available and families would email mask exemption at charleston.k12.sc.us and would provide that form and whatever required associated documentation to have that request reviewed and either, approved or denied. I believe in the paper, it stated that we approved about 80% of those exemptions submitted. And so those have slowed down. But that has been a process that we've also had in place along with the enforcement of our mask mandate, which extends until October 15th, but it's at the discretion of the board to convene and decide whether to extend it and or let it expire at that time. We have seen declines in cases in our students and staff over the past couple of weeks, about a 53% decline over the past 3 weeks, which is really great news. And we hope to continue trending in that same area. Non-COVID related, kind of shifting gears to our ESSER 3 funds. We have about $121 million still available. We have dedicated about $26 million to HVAC and indoor air quality updates that were approved by the board this past Monday. And then we have another portion that's dedicated to charter schools per the ESSER guidelines, about 10%. I think it's about 16 million or so. And so that leaves about 121 million left to spend. And we currently have our community-based organization application out still. That's where community-based organizations can submit to partner with the school district for certain programs and potentially be recipients of some of our ESSER fundings. in partnership with us. And I'm going to drop that application URL in the chat as well. That application process, it's about 9 parts. It's rather thorough. And it closes on the 11th, so next Monday. But that is open to any of our community partners in the area who would be interested in partnering with us to serve those students who have been most severely impacted by COVID-19 and experienced academic loss and looking for academic recovery. In addition to that, I think last time in our meeting last month, we were on the cusp of launching our new, kind of switching back to COVID here, our new dashboard that also has our close contact / quarantine numbers. And so now on our website, we have both our positive cases and our number of students and staff in quarantine. I'm dropping that URL in as well. Again, we've seen decreases in numbers in that close contact piece, so that's exciting. And we are continuing diligently with contact tracing. We have 4 temporary full-time staff that were added to help with that. In my office, we now have an office of translation and interpretation services that we got back in May. And so we have 3 full-time specialists that are able to translate documents, speak directly with families when they call, help with our contact tracers, primarily in Spanish, but also that department can also translate and interpret into different languages, but we have on-site interpreters specifically for Spanish. So that's really great. I overhear conversations all day long with families, between nurses and families who are Spanish speaking, to help support getting accurate information and answer questions for them. So that's been really exciting. That pretty much, I think, captures everything that we've had going on lately. Does anybody have any questions?
Any questions? Maggie, I've got a question. I know one of the sites you talked about, the Center for Advanced Studies in West Ashley, and that site obviously is in the city of Charleston. Last night when the, which by the way is a great facility, great school. I know several kids that are taking classes there, and it's awesome. So that's off to a great start. Last night when Strategy and Communications put out their full announcement about that, I happened to be at a high school volleyball game. People were excited that there's testing there, but there were some concerns because that school sits in the middle of the athletic facilities of West Ashley High School. It sits right outside between the football and the baseball stadium and in between the gym, and it sits right in there. People were concerned about sick people coming where athletes are hanging out, because they hang out all over that school.
Sure.
Before and after practice, and not just athletes, but also other ROTC and the band and people like that are there. But they were concerned about precautions since we may be bringing sick people onto that campus. So I thought I'd ask that.
Sure,
question.
absolutely. I don't have a more specific answer than just our general protocols of, the hard requirement of wearing a mask indoors at all times and keeping a safe social distance at minimum of 3 feet when other people are around. But that's certainly something I can bring up to our leadership, for more discussion about what that looks like, because I think in that particular location, it is in the training center, which I believe is within that actual building. So I certainly understand that concern there.
All right, thank you.
I'm not certain if the hours are after. I'd have to peek real quick. I think the hours for that
3:45 to 7:45, which is when there's athletes around there. So
right. So that definitely would make sense. So I'll definitely bring that back around to our leadership for some discussion, and I'll circle back with an answer.
great. Thank you so much, Maggie. Any other questions for Maggie before she goes?
Oh, and one last thing, a fun thing that's occurring on Friday is Lucy Beckham High School is going to finally have its school building dedication, as well as a congressional establishment ceremony for its Coast Guard JROTC program, which is the only one in South Carolina and the 3rd in the nation. So that's really exciting. It's a very, for lack of a better word, ceremonial ceremony that it's got a narrator by a cadet and a master of ceremonies and bells and ruffles and flourishes that will be played as people walk in. It's exciting. So that will actually be live streamed from Lucy Beckham. So you could go look up on YouTube, Lucy Beckham High School's YouTube channel, and there'll be a live stream available if anybody wants to tune in and see that process. It's exciting for the cadets and the students that are involved, as well as for the school in general, just to finally celebrate being open, even though they've been in operation for over a year and a half.
Great. That's outstanding. Well, thank you for all that you do. Great things going on in Charleston County schools. And, you know, we certainly appreciate all the work that you do, Maggie. So thank you so much.
Sure. We appreciate y'all. Thank you. Take care, everyone.
All right. Very good. Let's see. I'll just kind of, I guess I'll call on Jennifer Roberts for community update.
Yeah, good morning, everyone. I don't have too much of an update this time. We are still having probably the largest amount of staff leaving that we've ever seen, and not just in Charleston, Dorchester Mental Health Center, but across the state. So bear with us on, maybe we're not going to be as quick as we normally are to serve people, but we're working on different marketing strategies and things. But I know across the board, we kind of mentioned it last time, got a lot of head nods. Everybody else is having the same problems. It's across several different, I mean, it doesn't matter what jobs you're looking at. I don't know where all these people are going, but they need to come back. But, you know, other news really is we just received another grant, additional money from the Victims of Crime Act, and we're adding our, I think, 8th embedded law enforcement position up in St. George, if we can find someone to fill the position, of course. So we'll have another person working with victims of crime and working with law enforcement in the community. Other than that, I took a week and a half off and just got back from Montana. So
All right.
that's kind of all I know. But if y'all need anything, as usual, please email us and let us know.
Very good. Thank you so much. Appreciate it. Dr. Andrews, you have anything from MUSC? No. Dr. Meredith Belinsky, anything from Roper?
Hey, Roper St. Francis is alive and well, doing awesome. We just like everybody else has been saying, the trending is everything's trending downward, which is wonderful, but it still doesn't mean that we're out of the water. It still doesn't mean everything's great. Let's go back to normal type of thing. So I encourage everybody that when you do see trends and you do see it trending downward, everybody says this is a COVID war and we're winning. It doesn't necessarily mean that. It just means that the vaccinations, all that's helping and what we're doing. We still have over about 113 in our hospitals, and 81% of those patients are not vaccinated. So we're still pushing. We have a lot of resources out there. And Paul, I need to get back with you soon about helping the city of Charleston as well, and about vaccination spots and testing spots. We have changed a little bit, but all of our urgent care centers, express cares, where you can get vaccines there, you can get boosters there, we test. So it's all throughout our systems. And we want to emphasize again that since COVID-19 has taken pretty much mainstream and taken all the attention, I'd say, of healthcare issues, we still have healthcare issues. So you need to still come to our hospitals. We still are staffed for that. We are running through, like Jennifer was saying, with staffing and moving around, but we've brought people in. We're taking care of all of our patients in our community. So we're reaching out and doing a lot with our community benefits, our community needs. We're still reaching out and doing drug takebacks. We're doing Narcan teaching. I myself are doing that within the hospital system. So we're trying to tackle the other epidemics that are still out there that no one's that we haven't been talking about because of COVID-19 being so prevalent. So we really appreciate everything you do in this committee, and we're here for you. So anything, any other questions or anything else? I'm sure Susan MUSC is probably doing the same heavy thing. So I just saw a text from Susan, so I'll let you go. I'll let you go next. Thank you. If you have any questions, please feel free to yell at me or throw me an email or a phone call. I'll be happy to talk to you.
All right, great. Thank you very much. And Susan, I see you popped on there. Thank you. Oh, you're on mute.
Oh, Thank you for letting me jump in. I've got another meeting to get to, but I just wanted to give a quick update on the Charleston Healthy Business Challenge. We will be having our next in-person event on October 27th. And we are excited to actually focus on a topic that we have not previously, and it has been coming up at MUSC. And that is the issue of mental well-being, specifically related to by gender. What we have noticed in some of the surveys that we've done is that for whatever reason, I think we can all probably guess, because of COVID and the increased demands at home with folks with children, that women are taking on a lot more of the pressures related to work-life balance. And so we are excited to address that topic at our next event. Again, that'll be October 27th at the Harbor Club, and we'll make sure that we get the invite out to this group, and we would love it if you would share it with your colleagues.
Very good. Well, thank you very much. Anyone else? I do see, let's see, Aretha Jones Powers' name up there from Feder. Just checking. I don't see your face on there. But did you have any updates you wanted to give? Okay. Okay. Anyone else with community updates? I certainly don't want to leave anyone out. Okay.
Hey, this
hey,
is Lisa
Go ahead.
Hey,
Yeah,
this
go
is
ahead.
Lisa Burbage. I'm outside, so I hope y'all can hear me, but and I'm not on video, but I wanted to let you know, and first of all, I want to thank DHEC for giving me the opportunity to run so many community programs through my company, Wellness 5. We are offering, I've got enough money to run 4 programs on diabetes prevention. And this is grant money that they're getting from the CDC. And everybody knows that diabetes is a comorbidity for COVID. And so this money is out there, and they've given me enough to run 4 programs. So if you know anyone who is at risk for diabetes, and really 1 out of 3 Americans are, and they don't even know it, this is a great program. It's a prevention program. If somebody already has diabetes, they're not able to take it. It's a prevention program. And like Meredith was saying, the focus has all been on COVID, but there's a lot of epidemics behind COVID, and diabetes is one of them. So Candy Marlowe at the county has filled almost 2 of my classes. PIBA will get this money through Blue Cross Blue Shield. In 2022, I'll be working for Blue Cross Blue Shield with this program. And then later on, but they're going to open it only to the private sector. Eventually, it will be offered through PIBA. Don't know when. So Paul, if you've got any city employees, anyone else that wants to take this program, it's virtual and it's free. So I'm happy to, just reach out to me and let me know who might be interested.
All right. Thank you, Lisa. All right. Anyone else under community update? Paul, did you have something?
Yeah, I'll just jump in. The Bridge Run is doing its Kids Run Festival at Joe Raleigh Park, outdoors, wide open, a lot of spacing for children this weekend, and won't be overly crowded. So to be a nice family open area to participate from 2 to 6. The races will be somewhere between that 4:30 to 5:30 time, but it is a wonderful opportunity to come out. It's a totally free event. So I encourage you to think about that. And I want to introduce, she's not on live, but Penny Modzaleski is my intern, and she's one that did our minutes this last month and doing them today. So we'll welcome Penny to the spotlight, and she's a public health major at the College of Charleston. So glad to have her on board.
Yeah, thank you for all you do, Penny. You did a great job with the minutes too. Thanks so much. So we did have on our agenda Dr. Kimberly Butler Willis to give us a report, but I understand. Oh, I do see her on here. Okay, we will go. She's popping on now. There we go.
There she is.
Okay, Dr. Willis, we're calling on you right now. You had good timing coming on.
Oh, look at that. Look at God. Thank you guys so much. Sorry, I had a conflict and I was hoping I could jump back in. Paul asked that I share an update with you guys about the special commission. And so I don't know if many of you know, but during the two more recent city council meetings, two motions were made. The first was to advance the recommendations of that special committee. And the second was to make the commission a permanent fixture. Well, unfortunately, the council did not vote for the permanent fixture of the commission, but they did vote to move these recommendations forward. So as the Health and Wellness Committee, you guys should expect to see the recommendations that were drafted by the Health, Equity, and Environmental Justice Subcommittee. We feel like they are very solid, and I don't think there's anything in it that you guys would disagree with, but I'm interested in the conversation and feedback. But one thing I would like to advocate for and ask you guys to do is to please, if you're work in the city of Charleston or live in the city of Charleston, jump on those city council meetings. They've made it very easy to participate now that they're virtual. And please sign up for those public comment sections if you feel as though the city could really benefit from having a commission that is keeping the city accountable to making sure that equity is felt from all people in Charleston, not just some. And that's truly what this commission is there to do. It's 7 different subcommittees, all designed for different sectors. And it's not a regulatory body, it's just an advisory body to make sure that our city is able and fully equipped to draft policies, processes, services, and programs that really support our most vulnerable in our communities. So thank you guys for your support with that. As you have conversations with council members, please continue to talk about the commission. It does not have to be the people that are currently volunteering. It can be anyone from this committee to serve as chair as that health, equity, and environmental justice subgroup leader. So thank you guys for your support with that. And I'm excited for more conversation about the recommendations.
Oh,
Kevin, just 2 things. One, first of all, congratulations to Kim. She has been being recognized as a woman to watch by the YWCA, and she was doing her recording on the story of her life today before this meeting. So we'll look for something big in our community to recognize Kim. We're very proud of you. The second thing is that the recommendations Kim was talking about are the ones that I sent out in with the minutes today. And if you will take your time and just go through those and read those, they're really everything we've been talking about for the last couple of really almost last year or more. And it's one that I think we can easily wrap our arms around and take ownership of, and maybe at the November meeting, we'll look at them a little more deeply, but it's all about life expectancy and really opening our communities to better health opportunities. And so I hope you'll read them, you'll reach out to either Kim or me and with questions, and then we can look at how we implement them. I will say the disappointing part is that we did not get the grant we had applied for from the CDC to do our work in the the 29405 zip code, but we laid the foundation for a community working together. And now we will improve on that and be ready for the next grants, or something we can even implement through work with Healthy Tri-County and Roper St. Francis and MSC and all our other health partners. So a lot of good opportunity there. And maybe we'll have Kim back on the agenda in November, and we'll bring in the discussion we had with that grant, the things that we can do today going forward of how we can start looking at these life expectancy issues in our community. So thank you.
any other questions before we wrap up our meeting? And anybody else that I left out, or anything else we need to discuss?
Kevin, does Tracy want to have anything from the city that you'd like to update? Phase 3 or what we're doing in the city, Tracy?
I don't really have any updates. I mean, we're seeing the same thing as a community, decrease in employee cases and whatnot. So I think Dr. Richardson did a very thorough presentation on kind of what's happening. So nothing to add. Thanks.
Thank you, Tracy. Appreciate all that you do.
And Dr. Sears, Reverend Dr. Sears is on. I know that the faith-based community has been very supportive. I didn't know if she had anything to add into it.
Thanks, Paul, but nothing to add at this time.
All right. Thank you, Dr. Sears. Anyone else? Certainly don't want to leave anyone else before we adjourn here. But well, we went over just a few minutes, but we did pretty well. So I appreciate everybody's participation. Again, you're so valuable to the city of Charleston, this group. And on behalf of the city, thank you for all that you do and sharing your expertise and spending time with us. It makes our city a whole lot stronger and a whole lot healthier. So if there's nothing else for the good of this meeting, then we will stand adjourned. Thank you very much.
Thank you.